Please watch all the way to the end. Please leave a question or comment at the end. We'd love to respond. Don't forget, please check out our website at www.mypfi.org. Hi again, I'm Dr. Lennox Hoyte, fellowship trained urogynecologist and pelvic surgeon. And I often get a question from patients, hey, my surgery didn't work out. I'm unhappy with the outcome of my surgery. And so example of a specific patient who would come in and say, hey, I had this surgery to prevent me from leaking urine, and the surgery has happened, but I'm still leaking. What's going on? So it's gonna be really important when you think that you have a complication of your pelvic surgery has failed, for example, to try and determine exactly what aspect of it failed for you. So for example, you've had a surgery to prevent you from leaking urine and you're still leaking urine after surgery. Another example would be you had a surgery for prolapse repair and the prolapse is repaired, but now you're leaking urine and you didn't expect that. A third way to look at a surgical issue or complication postoperatively that might make a patient unhappy is you had a surgery, the problem's fixed, but now you're in pain. Or, for example, you had a mesh surgery some time ago and now you notice that the mesh is maybe causing a problem. So all of those are examples of surgical complications. And so, for example, when I have a patient come in to see me who said, hey, my surgery didn't work, the first thing I want to find out is which one of those things is that patient talking about? Is she talking about the fact that I was leaking before and now I'm still leaking? Well, if that's the case, then it's important to consider the different types of leakage. There's two kinds of leakage. And it turns out that if you have leakage because your urine tube is weak, and you fix the weakness, you might develop leakage subsequently because the bladder is overactive as a result of fixing the leakage from weak urine tube. So that's gonna be important to consider, and that's fixable in its own separate way. If, for example, you've had a prolapse repair surgery, you weren't leaking before, and now you're leaking after the prolapse repair surgery, it's important to consider that because often prolapse will protect you from a certain kind of leakage. And if you fix the prolapse without considering the possibilities when the prolapse is repaired, you might have an unexpected condition like urine leakage. Fortunately, if you came to us at the Pelvic Floor Institute, we do test for those eventualities in terms of, does your prolapse protect you from leakage? If we knew about this before the fact, we'd make it so that we could do something to make sure the leakage doesn't occur. For example, if you came to us, not every surgeon does that. The third type of complication we talked about was, hey, now I'm in pain from surgery. What do I do? And so now we've got to go and evaluate that patient. It involves an examination and maybe some testing to try and determine why it is you're in pain. Is the pain related to the actual surgical intervention? Was there a suture placed in a place that is now causing you pain, for example? So that bears looking at, and that's the kind of thing we would evaluate very carefully at the Pelvic Floor Institute if you came to us complaining about a problem after surgery. And the other kind is your surgery failed altogether. You went in for a surgery to fix the bulge and the bulge is still there. Now what? It turns out that you can get a proper evaluation from a fellowship-trained, certified urogynecologist or pelvic surgeon who can evaluate why it is your surgery failed. Many, many times, more often than not, if a surgery failed for any of the reasons we talked about, there's a way to evaluate that in detail and correct that. And at the Pelvic Floor Institute, as I mentioned previously, we do a lot of work before the fact. We do a lot of testing before we even take you to surgery to determine what will be the consequences of the repair of the thing we talked about. So if you're coming in for prolapse, when we fix your prolapse, are you gonna leak? Be nice to know that before the fact so that we can address potential leakage at the time of surgery concurrently so you don't leak. If you come in leaking after surgery to correct leakage, we could determine whether that surgical correction was insufficient, it was inadequate, or whether the surgical intervention caused a new problem. We also evaluate for that at the time of surgery preoperatively it's harder to check that one out, but we do talk to our patients about the fact that there's two ways to leak, multiple ways to leak, and that if you're leaking this way, we'll correct this problem, but you may leak this other way, in which case we would evaluate it after surgery, look at it, and get you cured, because that is the goal. Fortunately, at the Pelvic Floor Institute, we use surgical interventions for prolapse that are very durable and very effective. And so we seldom, very rarely encounter a situation where our prolapse repair surgery fails. Sometimes you might have a development that requires a little bit of tweaking of the part of the prolapse that may recur, but that's usually very fixable. But usually the big portion of the surgery does not fail very often, because we use gold standard methodologies and procedures that are well vetted and well considered to correct prolapse repair. Pain with surgery post-operatively is sometimes encountered, usually with surgery performed through the vagina to repair prolapse. Sometimes stitches can be placed too tight. Sometimes you can pull on tissues a little more than you was warranted for the repair, and that can sometimes cause pain. Certain kinds of transvaginal suspensions, like sacrospinous ligament fixation, for example, can lead to and cause pain, usually in the area of the buttocks and going down the back of the leg, and that's something that's addressed directly if that's the case of you having that condition after a transvaginal surgery. So if you have a transvaginal mesh surgery, for example, and the mesh is anchored in a certain way that it pulls across the muscles, that could also be a cause of pain. So it bears a thorough evaluation to determine what the problem is that you perceive to be after your surgery that makes you think that it didn't work. With the right kind of evaluation, more often than not, the defect, the problem, the situation can be corrected and cured, usually in the hands and the mind of a well-trained, usually fellowship-trained, board-certified urogynecologist or female pelvic surgeon. So I hope that helps. The fact that you have a complication or what looks like a complication from your pelvic surgery is usually something that bears evaluation. Go see your doctor first that did the surgery. Find out if they can help you determine the cause of the problem and whether it's related to your surgery or it may be something unrelated to the surgery. If you're not satisfied with what that information that doctor is giving you, it makes sense to go look for someone else who's appropriately trained, qualified, and has a long history of correcting surgical complications. That surgeon usually will be able to give you an answer that you may find more helpful in addressing the problem of failed or surgical complication. Dr. Lennox Hoyte, fellowship-trained urogynecologist, Pelvic Floor Institute. Please remember to like and subscribe. Leave your comments in the comment bar below. We'll try to answer as many of them as we can. Please do consider coming and seeing us here in Tampa Bay if you feel like you've had a surgical complication. We'd love to see you and evaluate you. Thank you so much.
So, patient who comes in complaining of complications with pelvic surgery usually comes in saying, I've had a surgical intervention and this is what's happening to me after. So depending on what her complaints are, one can examine her and determine if the complication is something that can be corrected surgically, if it's something that will be corrected naturally with time, or if that's a complication that can be corrected with something like physical therapy. So it all really depends on what the specific complication is.
Don't forget to like and subscribe. Please leave a comment or question. We'd love to respond. Don't forget, check out our website at www.mypfi.org. Thank you for listening.